Hi, my name is Dr. Rakesh Jalali. I am the medical director of the Apollo Proton Cancer Center here in Chennai. I joined oncology in the year 1991, and ever since I have seen tremendous improvements in the cancer care and cancer cure survival over a period of time. And that has been related to many advances in the term we treat cancer, we screen cancers at an earlier date, and also in general the awareness of the public at large. What we have also realized over a period of time that while the cancer cures and cancer survivals have improved, for example, in the US, anywhere between 65 to 75% of the cancer patients can be completely cured. In India also, it is as high as 40 to 50 to 60% in various data sets that we have. In particular, patients with childhood cancers, in patients who are in the range of what is called teenage and young adults, and some particular cancers even in middle age and older age, for example, breast cancer, kidney cancer, and so on and so forth. And obviously those who present and who are diagnosed relatively earlier stage, and also who have now what we call a favorable molecular and genetic profiles can be cured. And by cure we mean not only they survive for more than 2, 3, 4, 5 years, but by cure we means they have a normal lifespan, and that is our aim. What we have also realized, however, that while these cures are increasing, many a times these people who we call survivors or conquerors, they do face, a percentage of them do face some impact in their daily functioning, activities of daily living, and also in the social integration. And that is a very important aspect, what is called cancer survivorship. On this particular date, it's an appropriate date that where we, throughout the world, the oncology communities, the cancer survivors, cancer conquerors, the various NGOs and platforms who are associated with improving the lives of people with this disease, either at the treatment and post-treatment, come to the point that it is not important only to effectively cure and make these patients survive, but equally, if not more importantly, also to make sure that the quality of cure and the quality of survivorship is also at the highest standards. And there are many treatment strategies and management protocols and paradigms that can contribute to it. And I'll just list out a few. First, of course, the earlier stage we diagnose the patients, the treatment morbidity is also very less. Number two, their effects on, for example, growth, on their cognitive ability, on their memory, on their, in particularly in children, is very, very important. But also the physical aspects of very little dose to very little morbidity towards the heart, kidney function, and so on and so forth are very important. And as I mentioned, this is particularly applicable for childhood cancers because not only they have a very high cure rate of more than 75%, a significant proportion of these do have issues of long-term cognitive, neuropsychological, growth hormones, and other significant issues. And also a small percentage can also have second malignant neoplasms because of their genetic predisposition and also because of treatment, for example, radiation and chemo. So several mitigating strategies have been employed. Number one, recognition that they should be diagnosed early because the treatment obviously is much less morbid and much less intense. Number two, to identify each patient and each person as a unique individual, try to understand the genetic and molecular makeup of the tumor, but also the milieu in which the patient is treated. Number three is to effectively devise treatment strategies which would ensure a very high chance of cure, but also this fine balance of achieving high cure, but also organ preservation, the function of that organ, whether it is chewing, swallowing, bladder function, continent function, sexual function, growth, coordination, the neuropsychological assessments and neuropsychological function, and these have to be maintained between the two treatment paradigms. And whether we give less treatment, we de-escalate the treatment, These are very important. Number 4, a good strong spirit and a recognition of the fact that we must have long-term survivorship clinics where we look at the physical aspect, psychological aspect, but also importantly the social aspects. Number 5 is also, in general, there has to be a societal awakening, and I implore and I request all the viewers out there to have that feeling that these people should be treated with respect, with dignity, and with as much care and affection and love as anyone else in the society. So whether they're going to jobs, whether they have employment, whether they can have normal relationship, whether they can have families, whether they can function as anyone else in the society, is also not is not only a challenge or a responsibility of the patient and their family, not also about the doctors and the physicians, the hospitals and cancer centers, but also is societal, is the academia, is the industry, and all the employment agencies, so on and so forth. And finally, a continuous evolution of treatment, whether it is newer targeted therapies, whether it is very high precision radiation such as protons, which can limit the dose of radiation significantly to the normal structures and also can reduce several long-term survivorship burden, including growth retardation, neuropsychological impairments, and the incidence of second cancers. And these have to be integrated into the treatment philosophies such that we ensure that all the people who do get this disease of cancer get cured forever, but also equally, if not more importantly, have a very high level of quality of cure such that they function as normally as the society as anyone else.